My research at Memorial Sloan Kettering involved different pathways. One is clearly improving the immunotherapies that we have for patients with diffuse large B-cell lymphoma and follicular lymphoma. One of these immunotherapies is obviously bispecific antibodies, and we are developing a program which aims to explore in depth the mode of actions of these drugs. We are taking samples of tumors in patients receiving this drug and performing in-depth analysis of this tumor using single-cell analysis. Each individual cells in the tumor, how do they react to this treatment? How are they before this treatment, during this treatment, after this treatment? So that's the major effort that we are doing with Dr. Vardana, with Dr. Falke, and others, and a platform that we are using to better understand how this immunotherapy works. And we can also use that for new antibodies, new combination of bispecific with other drugs, and hence leverage an understanding of their mode of action and develop smarter way to use that. That's one major aspect. The second aspect is that diffuse large B-cell lymphoma, as well as follicular lymphoma, remains disease that are heterogeneous. And we know that below these names, besides this name, there's a variety of tumor. And we continue to work with our colleague in pathology, in molecular biology, and with the MSK Impact and other tools that have been developed at MSK to understand the different subclass of DLBCL, what are their clinical features, how do they respond to different treatment, how do they respond to CAR-T, how do they respond to bispecifics, and whether new targeted molecules can be developed to further treat this patient. We are particularly excited about several molecules which are still inhibiting the BCR signaling, the B-cell receptor signaling, or inhibiting a key transcription factor within B-cell, which is called BCL6. So research is ongoing in this area, both clinical and in the laboratory, and these are exciting paths. We have other features and other aspects of our research. One aspect that is important is trying to understand who are the patients that are at risk of developing lymphoma relapse in the central nervous system, the brain, or the spinal fluid. And Dr. Liu in my group is developing an exciting trial, an exciting study to identify circulating tumor DNA both in the blood but also in the cerebrospinal fluid to identify the patient at risk of developing disease in the central nervous system to adapt prophylactic treatment for them. That's also an advance for minority of patients who are at this risk, but which is probably possibly leading to major progress in this area.